Assessing the hair. So let's now proceed to the planning, which include assignment and equipment.
Due to the substantial knowledge and skills required, assessment of the hair is not assigned to AP. However, many aspects are observed during usual care and may be recorded by individuals other than the nurse. Abnormal findings must be validated and interpreted by the nurse.
Prior to performing the assessment, introduce self and verify the client's identity using agency protocols. Explain to the client what you are going to do and why it is necessary, and how to participate. Discuss how the results will be used in planning further care or treatment. Good day, ma'am. I am your student nurse, Pauline Tan. May I know your name and your birthday?
Shigit Mukhar, January 2000.
Perform hand hygiene, apply gloves, and observe other appropriate infection prevention procedures. Provide for client's privacy. Inquire if the client has any history of the following: recent use of hair dyes, rinse or curling or straightening preparation, or recent chemotherapy, presence of disease such as hypothyroidism, which can be associated with dry brittle hair. Did you use any of hair dyes or curling and straightening in your hair, ma'am?
No.
Ask about the product and the equipment the client usually uses on the hair. Assist the client to determine if the products are appropriate for the clients. Type of hair and scalp. Provide educations regarding hygiene of the hair and scalp. What equipment did you use in your hair, ma'am?
Brushes.
So, okay, ma'am. Brushes, it helps distribute this natural healthy oil from roots of your hair to the ends, giving them a natural shine. Thank you.
During the assessment phase, check the evenness of growth over the scalp, inspect the thickness or thinness, inspect hair texture and oilness. Normal findings. Natural hair color is opposed to chemical colored hair, varies among clients from pale blonde to black to gray or white. The color is determined by the amount of melanin present. Scalp should be clean and dry, sparse dandruff may be visible, hair smooth and firm, somewhat elastic. However, as people age, hair feels coarser and drier. Older clients have thinner hair because of decrease in hair follicles, pubic, axillary, and body hair also decrease with aging. Abnormal findings. Nutritional deficiency may cause patchy gray hair in some clients. Excessive generalized hair loss may occur with infection, nutritional deficiency, hormonal disorder, thyroid, hepatic, It also may result from chemotherapy or radiation therapy. No presence of infection or infestation by parting the hair in several times. Check behind the ears and along the hairline at the neck. Check the amount of body hair. Remove the gloves. And discard. Perform hand hygiene. As I am inspecting my client's hair and scalp, it seems that her hair and scalp is completely normal. Document findings in the client record using printed or electronic forms or checklists. During the evaluation, perform a follow-up examination based on the findings that deviated from expected or normal for the client. Relate the findings to previous assessment data if available. Report significant deviation from expected or normal findings to the primary care provider.
The next one is assessing the skin.
Now, let's proceed to planning. First, we have to review the characteristics of primary and secondary skin lesions if necessary. And then, ensure that adequate lighting is available. Equipments to be needed are millimeter ruler, clean gloves, and magnifying glass. Now for the implementation phase, prior to performing the assessment, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why it is necessary, and how to participate. Discuss how the results will be used in planning further care or treatments. Good day, sir. I am Reyna Villanueva, your student nurse for today. May I know your name and your birthday?
Harley Francis, January 12, 2010.
Okay, thank you, sir. I will be assessing your skin. It involves inspection and palpation. It is necessary because it gives you important information about partially serious disease. Is it okay with you?
Yes.
Okay, sir. Don't panic. Just relax. I have to perform hand hygiene and observe other appropriate infection prevention procedures and also provide for client's privacy. Now, inquire if the client has any history of pain or itching, presence and spread of lesions, bruises, abrasions, pigmented spots, previous experience with skin problems, associated clinical signs, family history, presence of problems in other family members, related systemic conditions, use of medications, lotions, home remedies, excessively dry or moist feel to the skin, tendency to bruise easily, association of the problem to season of fear, stress, occupation, medication, recent travel, housing, and so on. Reflect contact with allergens.
So the next thing we should do is to assess the client's skin. First thing we need to do is to inspect the skin color. So best assess is under the natural light and not exposed by the sun. So we should check skin that is not exposed from the sun. And now, can you please give me your hand? So as you can see, I'm inspecting the client. So the normal findings will vary from light to deep brown, from ruddy pink to light pink, from yellow overtone to olive. So the abnormal findings will be cyanosis, the pallor, the jaundice, and erythema. So after inspecting the skin color of the patient, we now inspect the uniformity of the skin color. So ma'am, can you please show me again your hand? So the normal findings generally uniform except from the areas that has been exposed to the sun. As you can see on the patient's hand, this part has been exposed to the sun and this part is not. So it is also uniformly dark for those people who has skin dark color. And of course, the areas has been lighter for lips, nail beds, and the palms. And the abnormal findings will be are areas in either hypopigmentation or hyperpigmentation. So after assessing the skin color, we now assess for the presence of edema. Of course, we need to check the color, the shape, the temperature, the size, and the degree of which the skin is intended and or pitted when pressed by fingers. So of course, we are going to measure the arm circumference of the patient using the millimeter tape. Since I don't have millimeter tape, I am going to use Medida. So ma'am, can you please hand that in your hand? Okay. So in measuring our arm circumference, it can be useful for the future purposes. So yeah, so the normal findings varies is there is no sign of edema. So after assessing the patient's edema, we are now going to inspect and palpate and describe skin lesion. So ma'am, can you please hand your hand? So we palpate the skin of the patient. So since there is no sign of skin lesion, we are not going to use lab. So if your patient is suspected with skin lesion or draining, we use gloves, of course, to prevent the transference of microorganisms or pathogens. And of course, we palpate the texture and the shape of the lesion. And of course, we determine the lesion according to its location, the size, the shape, the texture, the structure, the type, and of course the configuration of it. We also use millimeter tape to measure the skin lesion. There is also another method that we can record for the skin and size of the lesion. Of course, first we need to lay clean 2 double plastic on the wound or skin lesion, and we use permanent marker and mark it. After doing it, we dispose the bottom layer of the plastic, and then the top layer should be record on the client. And we only use this method if the wound is not contaminated by the wound. After that, if gloves has been applied, we remove it and dispose it. And after removing the gloves, of course, we do not forget to perform hand hygiene. So I will perform hand hygiene first. So the normal findings will be freckles, some birthmarks that has not changed since childhood, and some long-standing birthmarks such as strawberry or port wine hemangiomas, and there is no signs of lesion or abrasion.
The abnormal findings, various interruption in skin integrity, irregular, multicolored or racinae, some pigmented birthmarks such as melanocytic nevi, and some vascular birthmark such as cavernicus hemangiomas. Even this dangerous or deviation from normal may not be dangerous or require treatment. So assessment by an advanced level practitioner is required. If skin lesions are suggestive of physical abuse, follow state regulation or follow-up and reporting. Signs and abuse may include bruises, unusual location of burns, or lesions that are not easily explainable. If lesions are present in adults or verbal-aged children, conduct the interview and assessment in private.
Next, we're going to observe and palpate the skin moisture of the client by checking on the skin folds and on the unexposed areas. The normal finding should be the moisture in the skin folds and on the axilla will vary with the environmental temperature, the humidity, and also the body temperature of the client. And for the rationale in observing the client's skin moisture, it will let us know if there is excess moisture, which occurs in conditions such as hyperthermia, and for also if there is excessive dryness, which occurs in dehydration, as these are considered as an abnormal findings. Next, we're going to check the client's skin temperature, and we're going to compare the temperature on the two hands of the patients and on the both feet of the patients. And we're going to check using the dorsal part of our hands. Can we do like this now? Can you raise your both feet up? And for the normal findings, the skin temperature should be uniform and it has to be on the normal range. For the rationale on checking the client's skin temperature, it will let us know if there is generalized hyperthermia, which occurs in fever, and also generalized hypothermia, which occurs when the client is in shock, and also for localized hyperthermia, which occurs in infections, and for localized hypothermia, which occurs in arteriosclerosis. Then, after that, we're going to check the client's skin turgor, which is the fullness and elasticity, and we're going to do that by lifting or slightly pinching the skin on the clavicle area. And for the normal findings, when we pinch the skin and it turned back to its previous state, we will know that the skin is still elastic. And it is slightly slower for older adults when doing that. Then for the rationale, the taking note of the skin's turgor or elasticity will let us know if the skin stays pinched or if it stays tented or if it moves back slowly. This will take us know if it is dehydration, as it is considered as a abnormal finding. Lastly, we will take note and document all the findings on the client's record using printed or electronic forms or checklists, which is associated with the narrative notes of the findings. Then we can also draw the location of the lesions at the back on the body diagram. Then for the evaluation of the skin assessment, we can compare the document the findings that we've had to the previous skin assessment for us to know if there is changes on the skin lesions and on the abnormalities. Next, we're going to report the deviations on the normal findings on the primary care provider.
Today, I will be talking on how to assess the nails. So following the nursing process in planning, due to the substantial knowledge and skill required, assessment of the nails is not delegated to UAP. However, there are many aspects that are observed during usual care and may be recorded by individuals other than the nurse. Abnormal findings must be validated and interpreted by the nurse. So later on, I will talk about the equipment, the practices, the performance, the evaluation, and other more considerations in assessing the nails. For the equipment, we need Now talking about its interprofessional practice, assessing the nails is within the scope of practice for many healthcare providers other than nurses. Although these providers may verbally communicate their findings and plan to other healthcare team members, the nurse must also know where to locate their documentation in the client's medical record. For the implementation, first thing to do prior to performing the procedure, we should introduce ourselves and verify the client's identity using agency protocol. We should explain to the client what you are going to do, why is it necessary, and how he or she can participate. We should also discuss how the results will be used in planning further care or treatments. In most situations, clients with artificial nails or polish of fingernails or toenails are not required to remove these for assessment. However, if the assessment cannot be conducted due to the presence of nail polish or artificial nails, we should document this in the record. The following are the procedures in assessing the nails. First is to perform hand hygiene and observe other appropriate infection prevention procedures. And then provide for client privacy. And fourth is inquire if the client has any history of the following, like presence of diabetes, peripheral circulatory disease, previous injury, or severe illness. Fifth is to inspect fingernail plate shape to determine its curvature and angle. Sixth is inspect fingernail and toenail texture. Seventh, we should also inspect fingernail and toenail bed color. Eighth thing to do is inspect tissues surrounding nails, like intact epidermis, hangnails or parenchyma or parenchyma. Ninth is perform blanch test of capillary refill. Press the nails between your thumb and index finger. Look for blanching and return of pink color to nail bed. Then perform on at least one nail on each hand and foot. Before I proceed in performing the last assessment for nails, so what is a blanch test? A blanch test can be carried out to test the capillary refill, that is peripheral circulation. That is, document findings in the client record using printed or electronic forms or checklists, supplemented by narrative notes when appropriate. Continuing with the evaluation, we should perform a detailed follow-up examination of other systems based on findings that deviated from expected or normal for the client. We should also relate findings to previous assessment data if available, and report significant deviations from expected or normal to the primary care provider. For lifespan considerations, of course, we need to have a further knowledge in assessing the nails in all age gaps. For infants, newborn nails grow very quickly and are extremely thin and can be teared easily. For children, they can be bent, bruised, or ingrown toenails may indicate shoes that are too tight. Also, nail biting should be discussed with an adult family member because it may be a symptom of stress. For older adults, the nails grow more slowly and thicken. Longitudinal bands commonly develop, and the nails tend to split. Bands across the nails may indicate protein deficiency, white spots, zinc deficiency. Spoon-shaped nails may also indicate to iron deficiency, and toenail fungus is more common and difficult to eliminate, although it is not dangerous to our health. For more considerations in assessing the nails in patient-centered care or home care considerations, if indicated, we should teach the client or family member about proper nail care, including how to trim and shape the nails to avoid paralgia. To avoid cutting the skin accidentally, file infant nails instead of clipping. And in eyesight, fine motor control or cognition prevents the client from safely trimming the nails. We should refer him or her to a podiatrist or manicurist if the client requires assistance with nail care.
As an introduction about Braden scale, as wound care professionals, the Braden scale for predicting pressure or wrist is near and dear to our hearts. With that in mind, our evidence-based tool needs to be used correctly to yield accurate results. The primary aim of this tool is to identify patients or clients who are at risk, as well as determining the degree of risk of developing a pressure ulcer. What is Braden scale? Briefly put, the Braden scale is an evidence-based tool developed by Nancy Braden and Barbara Bergstrom that predicts the risk for developing a hospital or facility-acquired pressure ulcer or injury. How to score the Braden scale? Each risk factor on the Braden scale is rated from 1 to 4 based on the patient's assessment findings. When using the Braden scale, start with the first category and review each description listed across and choose the one that best describes the patient's current status. In the Braden scale, sensory perception is the ability to respond meaningfully to pressure-related discomfort. The resident is scored on a scale 1 to 4 as follows. Scoring 1 means completely limited. This is where the patient unresponsive or limited ability to feel pain over most of the body. Scoring 2 means very limited, meaning a patient responds only to painful stimuli or has a sensory impairment that limits the ability to feel pain or discomfort over half of body. Scoring 3 means slightly limited, meaning a patient can respond to verbal commands but cannot always communicate or has some sensory impairment that limits the ability to feel pain in 1 to 2 extremities. Scoring 4 means no impairment, meaning a patient has no sensory deficit that would limit ability to feel or voice pain or discomfort. There are 6 categories within the Braden scale: sensory, perception, moisture, activity, mobility, nutrition, and friction or share. When the scores from the 6 categories are added, the total scores indicate a patient's risk for developing a pressure injury based on these ranges. With a total of 15 to 18, the patient is at mild risk. With a total of 13 to 14, the patient is at moderate risk. With a total of 10 to 12, the patient is at high risk. With a total of less than 9, the patient is at severe risk. And that would be all on the Braden scale for predicting pressure or wrist. Thank you.
In Braden scale, you have the nutrition. So under the nutrition, you have the usual food intake pattern. And 1 indicates very poor. All you have to do is to never take a full meal. Rarely eats more than half of any food offered. Eat 2 servings or less of protein per day. Then take fluids poorly. Do not take any clear liquid dietary supplements or NPO maintain clear liquids or IVs for more than 5 days. 2 indicates probably inadequate, rarely eats a complete meal or generally eat about half of any food offered. Protein intake includes 3 servings of meat or dairy products. After that, is occasionally will take dietary supplements or receive less than optimum amount of liquid diet or tube feeding. 3 indicates adequate. Eats over half of the most meals. Eats a total 4 servings of protein per day. Occasionally will refuse a meal, but it will usually take a supplement when it is offered, or it is on a tube feeding or TPN regimen that probably meets the nutritional needs of a patient. Lastly, 4 indicates excellent. Eats most of every meal and never refuses a meal. Usually take a total of 4 or more than of meat and dairy products. Then occasionally eats between meals and does not require any supplementation. In Braden scale, we have the friction and shear. Under this friction and shear, we have the 1, which indicates the problem requiring moderate to maximum assistance in moving. Complete lifting without sliding against the sheet is impossible. Frequent sliding down in bed or chair requiring frequent repositioning with maximum assistance, and spasticity, contractures, or agitation leads to almost constant friction. 2 indicates potential problem. Move swiftly or requiring minimum assistance. During a move, skin probably slides to some extent against sheets, chair, raised strands, or other devices. Maintain good position in chair or bed most of the time, but occasionally slides down. Indicates no apparent problems, moves in bed and chair independently, and has sufficient muscle strength to lift up completely during move. Then maintains good position in chair and bed.
The PUSH is an acronym for Pressure Ulcer Scale for Healing. The PUSH tool monitors 3 parameters such as wound surface area, wound exudate, and wound tissue type. The PUSH tool is an accurate, straightforward, and therapeutically beneficial technique to track wound healing progress. The surface area, exudate quantity, and surface appearance of the ulcer will give the clinician an idea on how well the pressure ulcer will heal over time. Healing is taking place when the scores drop. The appendix contains a validated PUSH tool. The area of a surface is calculated by multiplying the length by the width. Surface area is given in ductile rather than a continuous measure to reduce measuring error due to minor variation. The amount of exudate present is evaluated and categorized as none, light, moderate, or heavy. The types of tissue found in the ulcer bed are referred to as tissue type. If necrotic tissue is present, it is a given score of 4. And if necrotic tissue is not present but sloughed, it is given score of 3. While granulation tissue receives a score of 2. A superficial wound that is re-epithelializing obtains a score of 1. And lastly, a score of 0 is given to the closed wound.
How to use it. Using a centimeter ruler, measure the maximum length or the head to toe and the side to side or the largest width. Then calculate the surface area in centimeters squared multiplied the two measurement, which is the length times width. Take note that do not make educated guesses. When measuring an ulcer, always use a centimeter and the same approach each time. Estimate the amount of executed or drainage percent after the dressing history and for any topical treatment applied to the ulcer. Executed or drainage should be classified non-mild, moderate, or heavy. So, tissue type refers to the different types of tissues found in the wound bed or the ulcer. If there's any necrotic tissue present, give it 4 on the scale. And 4 is known for scar or necrotic tissue which appeared black, brown, or tan tissue that adheres firmly to the wound bed or ulcer margins and may be stiffer or softer than the surrounding skin. If there's any amount of slough present but no necrotic tissue, give it 3 on the scale. And 3 is slough, which is it appears yellow or white tissue that is more serious and adheres to the ulcer bed in straight or large clump. If the wound is clean and contains granulation tissue, give it a score or scale of 2. Granulation tissue is a shiny moist that is pink or maybe red in color, and give it 1 to the superficial wound that is revitalizing or the epithelial tissue is new, pink or glossy tissue that grows and form the borders of an island and the ulcers of surface for superficial ulcer. And then score for 0 if the wound is already healed, closed, or the resurfaced epithelium has entirely covered the wound, or what we call the new skin.